getting the message that I am indeed live on YouTube for the first time in a while. So I am going to let people roll in here. I'm going to take a sip of water. I'm going to review some of the notes and the questions that came in earlier, and then we will get this party started. If anyone's here, the overachievers in the bunch, jump into the chat. There's a little chat box there that you can write your questions in. That's where I'll be taking your questions. And I would love to hear a couple things. Number one, that you're here. So just give me a thumbs up or something, say hi. And two, that you can see and hear me, because that is important. And then once we've established that, as people start to roll in, that will be the place where you can ask me your questions. I have a few that I have here on my phone already from people that chatted in earlier. So, I see from Abigail. Hi, Abigail. She gave me a thumbs up and hello. So I'm assuming that means that we are indeed good to go in terms of the visual and the audio piece. I see another hi, Dr. Josh. Thank you. That is from Local Adventures. Hello. So yeah, this is a fun thing. The tech involved in these live streams is really something quite remarkable. I mean, it's amazing. For some of you who know me, I do an exercise every week, not a physical exercise, but maybe a mental, familial type of exercise with my family, where I write a note to them, my kids and my wife, each week on Sunday morning, and I talk about 3 things that sort of struck me that week, things that made me think or made me put me in awe, just things that sort of struck me in some meaningful way. And usually it's like natural things, often health and medicine things that I learned or whatever. But I got to tell you, the tech that's involved in me being able to reach all of you that are out there in this audience all over the place with video technology is just something super awesome. So maybe that'll make the maybe that'll make the list this week. We're just past 7 o'clock now, and so if anybody is here and they have any questions, the chat little box there is the place to put them. Like I said, had some people request that I answer some questions in advance, so I have those on my phone. I'll read those off, and we'll start there. But for those of you who are just joining in, the chat box is the place to put your questions, and I will be reviewing that and answering them as we go. This is it's just a great opportunity to be here with all of you, those people who are newsletter subscribers who know my work, for something a little bit more intimate and something a little bit more personable. I think it's just a value add, hopefully, for you, and something that I like to do because it's a way for me to connect with all of you out there rather than just me behind my computer, either making videos or writing articles. So use the chat box for your questions. I see Steve's there. It sounds like we are in good shape in terms of the tech. So we've got the video, we've got the audio, and we have a few questions. So I'm just going to get started. The way I'm going to get started, and no one ever loves this, not me either, is just with the disclaimer. And the disclaimer is something like this, right? I am a doctor. I'm a physician, but I'm not your doctor. And so this experience is not about medical advice. It's more about medical education. So you can certainly, and you are welcome to, the whole point of this is to put your questions, put the areas of concern, the things you're thinking about, the natural products that you're considering, whatever the case may be, in that chat box, and I will do my best to answer them. I'm going to answer them in a general way, right? In the way that hopefully can be informative to the rest of the people that are here watching, rather than giving you specific medical advice. Like I said, I am a doctor, but I'm not your doctor, but that doesn't mean that we can't give you some very useful information here. So I'll keep monitoring the chat, and as we get started here, I'm going to use some of the questions that came in advance of this live through email to get us started. So the first question that came in, the overachiever in the bunch came in, and it was an interesting one actually, and it was about polyps. This is Polyps, polyps. And this question was from a person who had uterine polyps in the uterus, that then led to the uterus being removed, and then was subsequently found to have polyps in the gallbladder, which is that little sac that's dangling down off the liver there, and had now consequently been advised that the gallbladder ought to be removed, right? So this is a really interesting situation. The question there is, what's with all the polyps, right? That's the question. Why am I forming these? What can I do to not form these more? And is there anything I can do to save my gallbladder from being removed? It's a common thing that people, as they move through the years, when you confront the Western medical system, just have organs removed one after the other, right? They took your tonsils when you were younger. They took your appendix when that got infected. They take your gallbladder. They take your uterus, and so on. And most people that I know would like to keep their organs if they can. And that's what this case was really all about. So briefly, gallbladder polyps are very common, and usually they're not a big problem, right? They can become a problem in rare cases. It's about 5% or so, and this is not my area of expertise, but only a very small percentage of gallbladder polyps ever go on to be a real clinical problem, like a cancerous type of polyp. And they are also rarely obstructive. They rarely obstruct the ability of the bile in the gallbladder to go out. So in most cases, a problem like that, gallbladder polyps, can simply be monitored. And it would be monitored with serial ultrasound, so ultrasound studies at some interval, every 6 months, every 1 year, whatever the case may be, to just monitor their progress and make sure that they're not growing, make sure that they don't have a concerning look on an ultrasound or on a CAT scan, and make sure that they are not obstructing the outflow of bile from the gallbladder so that things, digestion is not adversely affected and there's not any right upper quadrant pain. So in most cases, I would be surprised if a surgeon wanted to just yank that gallbladder out right away, because usually that's not necessary. There may be reasons or situations where it is necessary. And then there's this bigger question. And the bigger question is, like, what's with all the polyps, right? Why so many polyps? And there are a lot of answers to that. The first one is genetics, right? It's unfortunate that sometimes people have family histories where they are polyp formers in various different places, in the uterus, in the gallbladder, and most importantly in the bowel, in the large intestine. That's the area that I would be most concerned about in a patient who presented like this. Is like, okay, you're forming polyps here, you're forming polyps there. What does the inside of your colon look like? Because that's the most common place where we find polyps, and that's the area where they can be the most concerning. And so I would for sure want a person in this situation to get a colonoscopy to make sure that they don't have polyps there as well, because there's a lot of problems that can arise from colon polyps. And then once we've established that, the general idea of decreasing the rate at which a person forms polyps is all about, big surprise, decreasing inflammation just in general. So inflammatory states, chronic excess inflammatory states, which are usually a result of poor lifestyle and poor dietary habits, increase the risk of developing polyps anywhere and everywhere. So that would be the first intervention. And there are actually some studies, believe it or not, and I've investigated this for people who were polyp formers in the past, on a number of the classic herbal anti-inflammatory ingredients that we use. Curcumin is probably the most powerful and the most well-studied. That's the extract from turmeric. And there are studies, both in animals and humans, that turmeric consumption, or curcumin more specifically, because it's more powerful, can decrease the rate or the conversion of polyps into more problematic forms. So there's your answer to the gallbladder polyp situation. I hope that works out well for you, and I hope that was helpful. A couple questions coming in. Yep, fairly local adventures. I see my knees are clicking when I walk. My knees are clicking when I walk. So like, this is normal, and that's the question. This has been happening for years. The popping, the clicking, the cracking sounds, these are not pathologic per se. There is a term for it, a medical term, and that medical term is crepitus. Crepitus is not considered pathological unless it's accompanied by inflammation, by pain, or by any other types of kind of symptoms that are clearly problematic. The noise by itself is really not problematic. Now, a lot of people have the question, what is that noise? Like, what am I actually hearing? And there's a couple different kinds of clicks and pops that can happen in a joint. The most famous, I'm a joint cracker, by the way, a knuckle cracker, and maybe I'll make the noise for you here. My microphone's up above me here. You can hear it. Oh, that one didn't go. Well, I guess my knuckles aren't ready to crack right now. But you know that famous sound, right? So that sound, that knuckle cracking kind of sound, is the result of a pressure differential that causes a bubble to form and then burst of nitrogen gas inside the joint. It's a bubble popping sound. There's been MRIs that have evaluated this, and you can actually see the bubble forming and bursting, and that's what's responsible for the sound that you get when you crack a knuckle, right? Or when a chiropractor maybe cracks your back or your neck or something. So that's the most common kind of noise, and that is not pathological at all. There's another kind of noise too, which is a sound that's more like a rubbing sound, like one tendon or ligament rubbing against another, or rubbing against like a bony prominence. And so sometimes, there's a lot of tightly packed structures inside there, and in a knee or in other joints as well. Ligaments, tendons crossing over various bony prominences. And you can imagine, if I just show you my knuckle here, if there was a tendon riding in that groove and you moved in such a way that it caused the tendon to, oh, my elbow just cracked there, caused the tendon to kind of ride over that bony prominence, it could make a noise, a clicking sound like that as well. And so that's another kind of version of cracking joints, or those kinds of crepitus type of noises. And then there's a third type, which is a grinding bone-on-bone sensation, and the feeling that goes along with that. That's usually accompanied by pain. But in this case, it sounds like there's probably not a lot of pain. It's been happening for a very long time, and it's probably not an issue. I do find that for people who are annoyed by that, stretching and or strengthening the relevant muscles that cross the joint can be helpful in minimizing the noise that they make, because people don't like having noisy knees. So we have another one, and then this is a great question. It's a big one, and it's from Kristen, who's asking about nutrition words of advice for weight loss, right? Weight loss is like, what a craze. I mean, we've always been fascinated by this question about nutrition and weight loss. In my recent NMI newsletter, I went back, I did about 100 years of history on fad diets, going back and kind of traced the history of them over the many, many years that we've been fad dieting, going back to the grapefruit diet, going back to the cabbage soup diet, where people were eating a bowl of cabbage soup every day. All of these in an attempt to lose weight. And then, of course, the current status is that right now we are in another weight loss craze, and it's a new one, and a particularly powerful one that's being led by Novo Nordisk and their famous drug Ozempic, which we don't need to get into that right now. The question was about nutrition, top nutrition words of advice. So I'm going to tell you what my top nutrition words of advice are, and I'm going to give you 3 words, and then I'll explain what I mean by those 3 words. The 3 words are down to earth. And that doesn't really sound like nutrition advice, I know. Let me tell you what I mean by that. So I talk about down to earth eating. In my writing, it's the way that I eat myself. And what I mean when I say down to earth eating is eating foods that were extracted from the earth, from the planet that we live on, and then minimal work was done to those foods in order to get them into a situation where they can land on your plate, right? I often think about this sometimes if we're talking about a supermarket or a grocery store, about shopping the perimeter, where you have produce, where you have fish, where you have meat, eggs, dairy products, etc. Those are minimally processed foods. They're foods that have not been adulterated, not had additives, not had subtractives, right? Where corporate giant food processing companies have had their way with that food, and it wound up in the middle aisles of that grocery store. And so I think, simply stated, without getting into I could write a whole book about this, and maybe I should. The best words of advice I have are to keep it as minimally processed, as down to earth as possible. And I think that is a way, there's no question that that's a way to minimize the excess calories that people get, because those highly processed foods are highly addictive as well, and people come back for more. When you eat minimally processed, whole food centric diet in that down to earth way, you'll find that you're much more sated, you're much full more easily, and have less of a craving for those toxic, sugar-laden, calorie-laden, fat-laden foods that are such a problem in America today. So down to earth eating, that's my best advice there. Let's see what else we have here. This is a good one. This is a question about anxiety. Gosh, we were just talking about obesity and Ozempic, and having just been through this pandemic, think about a lot of the things that are of epidemic proportions, and anxiety is one of them. This is a problem that, it's interesting, right? In clinical practice, people come in with all kinds of problems to a doctor like me, to an office like mine, all sorts of different problems, right? Knee pain, back pain, stomach problems, heart problems, blood pressure, thyroid problems, whatever it is. And it's very eclectic, and it keeps my life very interesting. But I got to tell you that no matter what that primary problem is in medicine, we call it a chief complaint. It's extremely common for that chief complaint to be anxiety. And if that chief complaint is not anxiety, it is very often a secondary or a tertiary complaint. So the person has stomach problems, they have heart problems, they have this, that, and the other thing, but they also have anxiety. So this is extremely common. And I would say that generally speaking, when people go to primary care doctors, like their GP for this, they basically have two main options. Number one is SSRIs. That's the drug class that Prozac is in, selective serotonin reuptake inhibitors, SSRI. And then also the class of drugs that are known as benzodiazepines. That's like originally was Valium, and now you have drugs like Klonopin, Ativan, Xanax, etc. And that's basically what people get. On some occasions, if you have a very astute and thoughtful primary care provider, they will send you to therapy, where hopefully you can get some cognitive behavior therapy, or to be able to talk through whatever issues you have. But that's basically it, right? You've got therapy, you've got SSRIs, and you got benzos. That's kind of like the trifecta. But there's a lot more that can be done for anxiety, a lot more. I break it down into a bunch of different categories. I mentioned down-to-earth eating already as a weight loss strategy. Guess what? It's also an anxiety-reducing strategy as well. Eating well is beneficial in so many different ways. We can talk more about it because I have a few more questions that go to the GI tract and the brain connection. But yes, eating well does matter. Lifestyle matters as well, including physical activity. Of course, we know this already. Getting good, restful, and restorative sleep also really matters. And then we get into where the rubber meets the road. This is like the tools in the naturopathic doctor's toolkit, the herbs, the nutrients, the amino acids and whatnot. And I'm going to just go through a short list of the kind of things that I find kind of high on my list of things that I use to help people who have anxiety. And I'll give you a few of them. Number one, an amino acid that's called 5-hydroxytryptophan, 5-HTP for short, 5-HTP, 5-hydroxytryptophan. That's a precursor to serotonin. So when you take 5-HTP, your serotonin levels rise. And when you have higher serotonin levels, well, you feel better. It's a similar effect, although a different mechanism, about the way those drugs that affect serotonin work. What we want to do is boost serotonin levels, and 5-HTP is a great way to do it. A lot of times, 5-HTP alone will dramatically help people who have anxiety. And so that's treatment number one. Number two is GABA, G-A-B-A, gamma aminobutyric acid. GABA is a neurotransmitter, actually. It's a neurotransmitter in the brain that calms you down. You know, you've heard of fight or flight before. There's also this thing called rest and digest, the opposite of fight or flight. And rest and digest, that system is controlled by the parasympathetic nervous system, and the main neurotransmitter of that system is GABA. And you can take it. You can take it orally, and it will get absorbed into your bloodstream and help you feel that sense of calm. So we've covered 5-HTP and GABA. Those are nutritional compounds. Jump over into herbal medicines. I love saffron for anxiety. There's a lot of studies about saffron for both depression and anxiety. It's very, it's the stamens, those little threads on the inside of the autumn crocus flower. There's just 3 of them per flower, which is why it's so light and so expensive to buy, because it takes so much manpower to harvest it. But saffron is not only a delicious spice to use in cooking, famous for its role in paella, but it's also a medicine. It's a true herbal medicine in the true sense of the word, and great stuff for people who have anxiety. Let's move over now into minerals. So common to see people who have mineral deficiencies, and magnesium is probably chief among them in the people who have anxiety. When you have not enough magnesium on board in your system, your body will feel tight, your mind will race, and so adding magnesium into the mix can be helpful as well. So what we cover there: 5-HTP, GABA, saffron, magnesium, lavender, it turns out, it's also very useful for anxiety. And there's passion flower, which I also love for anxiety. The herbal medicine toolkit is just extensive, and there are so many out there that can be useful for anxiety. So I hope that is helpful as well. There's so much that can be done to manage anxiety before you get to the drugs. And I want to address that just for a second, because I think it's an important thing, right? When someone has a problem and then they present to a Western doctor for that problem, it's like drugs is like usually that's the currency of most interactions. So it's like, here's my problem, and they have an offering, which is a prescription for a drug for that problem. And there's a lot of situations in anxiety or in all sorts of other kind of healthcare areas where a person doesn't want to take a drug, and they have good reason not to want to do that. You know, they whatever their reason is, you know. And it's amazing to me that when a person has a problem and the proposed solution is a drug, but then the person doesn't want to take that drug, there's kind of like nothing in between. Like the doctors are just like, well, then I don't know what to do. I don't know how to help you. And that's really frustrating and really problematic because there's all kinds of stuff in between doing nothing and doing that unpalatable drug that could be really helpful to a person. I just rattled off the top of my head 5 or 6 or 7 things for anxiety that could be useful to a person, that are safer than drugs, that are less expensive than drugs, and might as well just be as effective as the drugs as well. And so it's very frustrating to me, and it's kind of really what my whole mission in my professional life is to fill that gap, right? Just because you don't want to take a drug or get a surgery doesn't mean you have to do nothing. There's all kinds of things that can be done for healthcare problems that exist in that space. And so I hope that's helpful. Let's see. I have, I see some comments about magnesium as well. And yes, magnesium is awesome. It's the number one mineral deficiency in the American population. Micronutrients are really, really important. And let's talk about magnesium here for a second. So magnesium is a mineral that's in the soil, right? It exists in the soil. And when that soil grows plants in it, the plants suck the magnesium up out of the soil and put it in the broccoli or in the cauliflower or whatever it is, right? But if that soil is used over and over and over again to grow crops, and that magnesium is not replaced in the soil from good agricultural practices like they would do on a regenerative farm, well, that magnesium in the soil gets depleted, and therefore the broccoli that comes out of that field doesn't have as much magnesium as it used to. You've seen this before, perhaps you've seen the headlines. An orange today has 10 times less vitamin C than it used to. You know, a head of broccoli has 20 times less magnesium than it used to, and it's true mostly because of soil depletion, because of our corporate profit-driven agricultural practices. That's why I'm such a big fan of that regenerative type of farming, organic, small, local farms, because the soil's healthier, which means the foods that comes out of it's healthier. So that's one reason why everyone's magnesium deficient. So many people are. The other reason is that many people just don't eat the foods that contain the magnesium, right? That's the whole foods, that perimeter, that down-to-earth eating that I was talking about. Those are the things that are rich in magnesium. Many people eat highly processed foods, so they're depleted even if, no matter what, they're not even eating the good foods that contain magnesium. And then third, another epidemic problem is stress. So stress causes an excess demand on magnesium in your body. It's actually part of the enzyme system. It's a cofactor, like a fuel for the manufacturing of all these things like serotonin and dopamine and whatnot. And magnesium is used in that. So if you are using that chemistry a lot because you're really, really stressed out all the time, you're going to draw on your magnesium stores more significantly. As a result, your magnesium is going to get depleted. So there's 3 good reasons why so many people are magnesium depleted. And that's the reason why so many people do so well when they add magnesium into their program. It helps them sleep, it helps them relax their muscle tension, it helps calm them down, improve their bowel function, all kinds of things that magnesium can be useful for. So I would say of all the minerals that are out there, it's the one that I use in clinical practice, I think, the most. Let me go to it. I have another question here that came in. This one's sort of coming from with a different problem set entirely, and that problem is psoriasis. So psoriasis is a skin disease, right? And it has this sort of tragic nickname. And the nickname of psoriasis is called the heartbreak of psoriasis. You'll see that. It was like in old advertisements and whatnot. I don't know who coined that term, but it really can be a heartbreak. It can be a disfiguring condition for people, and it's these big silvery plaques and scales that you see on people's skin, and it can be, from something really mild and small, like a little spot on someone's skin, to full-blown involvement that can be really, like I say, disfiguring for some people. So There's been a lot of work on psoriasis. There's a lot of interesting new data to report that's very consistent with the kinds of things that naturopathic doctors have been saying. So I'm going to say it here now. Psoriasis is a gastrointestinal disease. So it manifests itself on the skin. Yes, we call it a skin disease. It's something that you would go to a dermatologist for, right? But it's only manifesting itself on the skin. That's where it shows up. The newest evidence, the latest and greatest science on this issue is that this is a gastrointestinal problem. That's where the core of it is. It reminds me of Hippocrates, who said all disease begins in the gut. And it turns out that, like, I don't know, it was 100% right, but pretty darn close. And psoriasis is one of those diseases that's very clearly linked to pathology inside the gastrointestinal tract. And by that I mean an alteration in the balance, the diversity, the health of the microbes, the flora, the bacteria, the good guys versus the bad guys that live in the GI tract. When that balance gets upset, and when there is inflammation and increased permeability, you might have heard the term leaky gut inside the GI tract, that sets the stage for the development of autoimmune disease. And in a susceptible person, that can manifest itself as psoriasis, and it often does. So here we go again with the difference between a natural medicine approach and a conventional medicine approach. You go to a dermatologist for psoriasis, you're going to get skin treatments, right? And those skin treatments are going to be topicals, they're going to be anti-inflammatories, they're going to be, all these drugs, usually topical ones, that will help to minimize the inflammation and that plaque formation. You go to a naturopathic doctor, they're going to be less concerned, not completely, but less concerned about what we put on the skin and more about what we do treating this problem from the inside out. So the treatment plans for psoriasis are targeting the restoration of microbial health, of gastrointestinal health, the health of the intestinal lining. And I have seen that approach pay off big time for people who have psoriasis. Now, it's not just that simple. I'll give you a couple more tips for anybody who's suffering out there with psoriasis as well. There's also strong connections between psoriasis and vitamin D deficiency. Vitamin D, of course, we get from the sun. Here's an interesting fun fact. There's a place in the world, in the Middle East, in Israel actually, that is called the Dead Sea. You might have heard of it before. It's a source of these beautiful mineral salts that come from this highly salty sea that's there. And there's also this mud that's mineral-rich mud. And it also is, the fun fact here is that the Dead Sea is the lowest point on Earth. It's extremely low. So when you go there, there's a sign that says sea level, and then the road goes down from there. So you're in this deep canyon, and at the bottom of that canyon, there is this body of water, which is highly, highly salty. So and it turns out that down there in the Dead Sea area, there are all these psoriasis clinics, like retreat centers for people who have really bad psoriasis. And the reason why I know about this is, number one, I've been there, and two, I have literally made the recommendation for people who have, really severe psoriasis to go there, because when they go there, they get dramatic improvement in a very short period of time for several reasons. One, they can bathe in these mineral salts. They'll do the mud baths, which are amazingly healing for the psoriasis for all kinds of reasons. And two, because you're so low, there's a lot of atmosphere above you, which means that the sun is being filtered through more atmosphere and less likely to cause a burning sensation, even though it's very hot there. So you don't get sunburn, and you can accumulate these large vitamin D doses without the risk of getting sunburn. And that's why the Dead Sea is a haven for people who have psoriasis. So I always put people who have psoriasis on vitamin D, especially if they are deficient. We usually measure that and then optimize their level of vitamin D. And then lastly, I don't want to minimize the idea that we should treat the skin. When people have a skin problem, it's very important that you try to give them something that can help with their skin. And my favorite thing to put on the skin of someone who has psoriasis is Manuka honey. Manuka honey is a specialized honey from New Zealand. I formulated a product that actually contains it at Up Wellness. It's called Manuka Miracle, that contains Manuka honey, among other things, which are also healing for the skin. And I love the application of Manuka honey. It's anti-inflammatory, it's antimicrobial, and it's healing to the skin. There's tons of research about this, and a great thing to consider for someone who has even just a small spot of psoriasis or a more widespread condition, to use a balm or a salve that's made with Manuka honey. So that's a good one. I hope that is helpful. we're coming up on a half an hour here, so I'm going to tackle another topic or two. I'm just looking at my phone real quick while to read this next question. So this is a good one, and I think that that this is a common problem that hopefully can be helpful. Hopefully my answer can be helpful. And it's about dizziness. So the question came in, I'm dizzy all the time. And I don't have a whole lot of detail. This question came in earlier today. And this is an extremely common complaint. People who feel dizzy intermittently, they don't know why. It's kind of scary. It's really unsettling. Maybe sometimes people feel like they're going to pass out, or they feel, all kinds of bad when they're dizzy. And yeah, listen, dizziness is like I say, extremely common problem, and it's a really challenging one for doctors because there can be so many different reasons why people are dizzy. So I'm going to talk about a few of them. Again, I don't have the specifics of this case, but I'll give you sort of the way that my mind works, or the kinds of things that I'm thinking about when someone comes in and tells me that they feel dizzy. So the first is like, what kind of dizzy is it, right? So some people feel lightheaded, and that feeling is usually like, I think I'm going to pass out kind of a feeling. And so I'll ask people, like, does it feel like you're going to fall over? Does it feel like you're about to lose consciousness, like you're going to pass out or faint? And if so, that's the lightheadedness kind of dizzy, and we will go down, and we can talk about that in a minute, we'll go down a certain road with that person. Another person might tell me that they feel like the world is spinning, right? Or that they are spinning inside of the world. And that's a different kind of dizziness entirely. That's called vertigo. And vertigo can happen for also a whole bunch of different reasons. And so if they describe a spinning sensation, that's another angle, like another road, another line of inquiry that I would have with that person to try to understand why they're feeling that way and what to do about it. So let's take both of those roads really briefly. The first one is the lightheadedness route. Like if someone's dizzy because they're lightheaded, I'll ask them, does it happen when you stand up really quick? If it does, which is very common, it's probably because the blood pressure is not responding to your change in position. So when you are lying down or sitting, your heart's doing what it does and keeping your blood pressure high to manage your current posture. Then you stand up and gravity has its pull on you and the blood falls out of your head, and and what your heart and your blood vessels are supposed to do is tighten up to keep the blood inside of your head so that you don't get dizzy. If that's not happening, you have a blood pressure control problem. We're seeing a lot of that these days. There's a problem called POTS that you might have heard of, POTS, postural orthostatic tachycardia syndrome. When the person stands up, their blood pressure drops, their heart rate speeds up as a result to try to keep that blood up in the head. Very, very common problem. It seems that the coronavirus pandemic that we had actually seems to have a role to play in creating a lot of new cases of POTS, which is really unfortunate and pretty confusing and frustrating for patients and doctors too. So that's lightheadedness. It's very common to have this in people who take blood pressure medicine, believe it or not. So blood pressure medicine is supposed to lower your blood pressure, which is a good thing if you're trying to protect your heart, not have a stroke, not have a heart attack. But it's not such a good thing if you feel dizzy. And there are lots of people, especially seniors, that are over-medicated on high blood pressure medicines, causing them to be dizzy, which leads to a whole new set of problems. A lot of times these folks are so dizzy that they fall, and then when they fall, they break a hip, they hit their head, they fall down the stairs, all kinds of trauma can happen. So dizziness is not something to be ignored, right? That was the lightheadedness kind of dizzy. Now let's talk about the other kind of dizzy briefly, and that was this road over here, and that is the vertigo kind of dizzy. This is just an awful feeling. People who are suffering from vertigo, whatever the cause, are some of the most miserable people that I've ever seen. And I don't mean miserable like they're miserable to be around. They are just in misery, right? It's agonizing to have the room spinning. They're vomiting. They just feel awful. They wind up going to the emergency room. There's a bunch of different causes of vertigo, a bunch of different types of it. I'll talk you through just a few of them and kind of what we might do about them. The first one is probably the most common, and that is called BPPV. It's an acronym. Benign paroxysmal positional vertigo. And that story is one that usually says, I flipped over in bed, I turned my head, I was getting my hair done at the hair salon or something, I tilt my head back and woof, the room starts spinning. And it is absolutely awful, terrifying, and totally unsettling. You can't function at all. People fall to the ground, they'll often be vomiting in that case. And so if the dizziness is provoked by head position or postural change. Usually it's tilting head back and looking upward. That is benign paroxysmal positional vertigo. The benign, that's a good thing. It's benign. It's not a malignant disease. It's not going to kill you. Paroxysmal means it happens in waves. Positional, related to the position of the head, and then vertigo. This problem is caused, it's in the inner ear is where the source of this problem is, and it's related to these tiny little stones, believe it or not. They're called canaliths, in these canals inside the inner ear, which is this intricate mechanism on both sides of your head that controls your balance system, right? And there's fluid in these canals that's washing around when you move your head, and that washing of the fluid causes these tiny little hairs inside those canals to kind of like sway, like the grasses in the wind, or like the kelp in a seabed or something, right? Like swaying like this. And that swaying, those little hairs that are swaying with the sloshing of that fluid are connected to nerves, and the nerves then very quickly tell your brain, your eyes, what just happened, right? Am I on a roller coaster? Did I just turn my head to the left? Did I just turn my head to the right? All that's being communicated instantaneously by the movement of those hairs in response to the sloshing of that fluid, and then your eyes and your brain right yourself depending on what your head is doing. Well, if there are stones in that fluid, if there's gravel in there, well, that grass or that kelp bed is like behaving differently because it's getting beaten around, by the boulders that are floating around in there. If that happens, your brain and your eyes are getting a message that you might be on a roller coaster when in fact you just turned your head. And it's that mismatch that causes the dizziness, right? Your brain's correcting for the roller coaster, but really all you did was move your head. You're going to feel dizzy and the room's going to spin. That's BPPV in a nutshell. And the treatment for that, oddly enough, is a very structural one. It's a maneuver that can be done in an office setting. There are some versions of this maneuver that can be done at home. If anybody has additional questions about those maneuvers, we can talk about it. It's kind of more than I want to get into now. But in the office, it's called the Epley maneuver. And the Epley maneuver is a series of motions you can put someone through that make them profoundly dizzy when you're doing it, but cause those stones to sort of drain out of that system so that the fluid is no longer contaminated and those hairs can wave just like they want to. So that's a treatment. And again, there's a few different kind of, one of them is called a half somersault that you can look up on YouTube if you want, demonstrating people how to do it themselves, or a version of it themselves that can be very effective. I also find that the amino acid, maybe one of my favorite amino acids, which I know is a nerdy thing to say, is called NAC, N-acetylcysteine, and that makes that fluid that's in there a little bit more thin. And when that fluid is more thin, people feel less dizzy. It's more easy to get good results with that Epley maneuver, and so I always use NAC in cases of BPPV. There are other reasons for vertigo as well. One of them is called Meniere's disease. I'm not going to talk about that too much right now. A very serious and debilitating disease that causes vertigo. It also causes some hearing loss and a feeling of fullness in the ears. A very difficult disease to manage, but vertigo is one of the main symptoms. So if there's hearing loss with it and that feeling of fullness in the ears, that's something to be checked out for. And then there's another thing that comes up, which is called cervicogenic vertigo. Cervicogenic vertigo is coming from the neck, the cervical spine. And so it's not uncommon actually for people to have tension in the muscles of the neck, especially way up high where the neck meets the skull, and that tension putting pressure on nerves and or blood vessels up in that area that can then cause headaches and dizziness. So there is a problem called cervicogenic vertigo that is an issue as well. So I hope that helps with the dizziness question. There's one more on here that I want to talk about too, because it's a subject that's close to my heart, actually close to my house too. And that was a question that I got, kind of a general question, but just about the usefulness of lion's mane mushrooms. I don't know if any of you have heard about this. If you have, like, put a thumbs up or put a mushroom emoji or something in the chat. I want to talk about them briefly for a couple of reasons. The question was, are lion's mane mushrooms like as good as everybody makes them sound, right? And I would have to say that the answer to that question is yes. I'm a big fan of lion's mane mushrooms. and the research on them that's coming out lately is so compelling. There is so much data coming out all the time about this mushroom and extracts made from it for improving the health of the brain, right? Improving memory, decreasing the risk of having age-related cognitive declines. And so that's mostly where the research is pointed on lion's mane. And it's kind of crazy, right? Because lion's mane looks like a brain when you grow it. I'm going to talk about that in a second. It has this brainy look to it. And it turns out that there are compounds in lion's mane that are very, very beneficial to the brain. And again, there are multiple studies about this that are very compelling. And I think that research track is just getting going. The other thing is that lion's mane tastes delicious. So, and I'll answer the question about where you can find it shortly. They're delicious. So they have a meaty texture, a lovely taste. And I would challenge most of you that if a person who knew what they were doing in the kitchen used lion's mane mushroom as a base to make like a crab cake, like an imitation crab cake, that you wouldn't know the difference, that you would not know that you're eating a mushroom cake instead of a crab cake. It's like, has that same texture, has that, maybe not the same taste, but most of a crab cake taste comes from the garlic and the spices and whatever else that you put in there. But lion's mane mushroom is amazing in the kitchen, super versatile. I have a setup in my basement. Like, I'm pretty like geeking out about this for the last few years. So I have this, like, I guess you call it a tent. It's kind of like a rack of shelves that's encased in a plastic zippered kind of outside. And there is a humidifier that I have on a humidistat control system and a fan that brings fresh air in. And then I have big blocks. I'll show pictures of them to you someday of lion's mane mushrooms growing in my basement. So these are colonized hardwood blocks that have the mycelium, which is like the root structure of lion's mane mushrooms, growing throughout them. And it's all happening inside an enclosed space, inside this bag that's filled with hardwood sawdust, and the lion's mane has colonized that sawdust, and then we open up the bag and the lion's mane just comes bursting out. So I'll show you pictures of my setup and the lion's mane's mushrooms as they grow. And to your question there, you don't need to grow them yourself. They are fairly easy to find now because there's lots of people who are doing what I'm doing in my basement for personal use. They're doing it at commercial scale. So warehouses, shipping containers full of those blocks growing lion's mane mushrooms. And you can find them at specialty stores. So this is like, the big one would be like Whole Foods Market or similar markets like that. They're not inexpensive. I've seen lion's mane mushrooms, at commercial sale at farmers markets for like anywhere between 10 and maybe 17 or 18 bucks a pound. And that's why commercial growers are growing them, because they can grow it for a lot less than that and then sell it to restaurants, sell it to farmers markets, to customers directly. But I'm a big fan of lion's mane mushroom, both as a culinary, eating it ingredient in the kitchen, and then also, and I see that Kirsten asked a question about using mushrooms as powder. So lion's mane can also be dehydrated, powdered, and then put into food. It can be put into drinks. It's commonly in powdered drink mixes. It's included in a couple of wellness products that are in our Mojo line, have lion's mane mushrooms in them, and people just powder it sometimes and put it in capsules directly, especially if they're really, really trying to get like daily doses for neurocognitive health, for people who have either risk of or have bona fide Alzheimer's disease or other kind of neurocognitive diseases where they're really looking to get high doses. So that's my story on lion's mane mushrooms. And like I say, I promise you, I'll take some pictures of the setup downstairs and show you what the lion's mane looks like in real life. So listen, everybody, here we are, 45 minutes in. My voice is just about done, and I think we got all of your questions answered for today. I hope this was helpful to all of you. If it was, we will look forward to doing it again for NMI subscribers. I'm so grateful for you being a subscriber to this channel, to the newsletter that I put my heart and soul into every month, and to just being here with me today and being in this family of Apona. So thank you so much for being here. I'm going to sign off now. Take good care, everybody.